Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Indy back here with us today for his third treatment. We wanted to show you kind of an interim treatment on him because he's been suffering from really severe hiatal hernia issues for how many years now?
5 years.
5 years now, and he's been under all kinds of medication and different treatments that have not helped him. So he decided to fly across the pond. He's from the UK, and come over and see us here in the US. And I told him to go out and enjoy all the US's bad habits like fast food, cheeseburgers, french fries, and all that, so that we can test his hiatal hernia. But I'm going to do some unique treatment on him today, which I'm going to show you. I'm going to get some deep tissue work into his thoracolumbar spine and his thoracic spine, where the ribs attach to the vertebra in the back, and also the intercostal muscles, which oftentimes get in spasm and restrict breathing. Because a lot of you that have hiatal hernia or GERD or acid reflux notice that it affects your breathing and restricts that. So we're going to help open that up for him today. Let's take a look in the mirror for me here first. And let's have you flex your head forward and then backwards first, please, Indy. All the way back, remember. There you go. Now back to neutral. Take a deep breath in for me, please. Let all air out. There we go. Much better actually today. You're not translated as much. Your head's not as far forward either. Pelvis is centered. You're definitely looking better today. You're a little bit rotated still, so I bet you're still sleeping on your side mostly.
Yes, I am.
Yep. Okay, very good. So I'm going to give him a break today on the decompression. So Indy, let's have you come over here and lay on your stomach first for me. I'm going to have you put your face right down in here. Now, I use this blue emu oil, this extra strength blue emu oil. It's much better than like BioPhysics or a lot of those other topical muscle analgesics that you get on the market. So I'm going to kind of warm his skin up here, and then we'll put this on up and down his spine on his paraspinal muscles. This is a ton better than just a massage, because I'm going to get really deep in his paraspinal soft tissues from his pelvis all the way up to his cervical spine. So we're going to start right down here in the pocket on the left side, and I'm putting some deep steady pressure. Just breathe in through your nose and out through your mouth for me, Indy, and slowly. There we go. You're going to feel some sore spots along the way, like right there specifically. Feel that one? That knot? Yeah, you can even see my elbow moving on it. There we go. That one right there too. Keep breathing. There you go. The part that's important about this is you gotta have the patient continue to breathe. And you work all the way up into the traps and all the way over. See, he's got a lot of knots in his traps up here too. Okay, so now that was the left side. We're going to do exactly the same thing on his right side. Keep breathing in through your nose and out through your mouth. And by the way, we're going to show you a video on our marathon runner from Phoenix tonight. She's doing a ton better today. So we'll show you an interim treatment video on her this evening too. And she does now have hope, as opposed to being hopeless, because a lot of doctors will tell you you just got to live with this and sleep at a 45-degree angle and, you know, stay away from certain foods all your life. But that's not true. Sleep, you know, propped up, don't want to do that. That actually causes it to get worse. And a lot of people are told that this stuff's in their head too. It's not. It's a biomechanical and musculo-ligamentous, neuromusculo-ligamentous disorder. Neuromusculoskeletal, which means structure, the vertebrae themselves, which are 24 individual freely movable vertebrae from the cervical spine at C1 all the way down here to L5 at the base of the spine. Now you can see his rib cage is really pretty symmetrical right now, including the bottom part of his ribs, which are all cartilaginous. See, those are very symmetrical there from side to side now. The right one's a tiny bit lower, but not bad. So I'm going to put my main focus right here. Is that where it's the most sore right there?
Yeah.
Now you can use your thumbs like this, but if you do that for very long, you'll have pancake-looking thumbs, so I use my elbow much more. I'm just doing some lateral and oblique stretching right now. And now, I'm actually going to take another towel and put it on his back so I can adjust him without slipping, sliding. There we go. Okay, so. Just keep breathing. Adjust his left SI joint first. Well, that one moved good. You feel that? There we go. And then the sacrum, which is right in the center. And he's been having some issues with his piriformis muscle too. He does yoga and he's had some problems with the piriformis, which is right here. And it goes between the sacrum and the middle triangular shaped bone over to the greater trochanter on the femur, the hip joint itself. And to isolate that piriformis, if you get your elbow in there and then internally rotate and then externally rotate, you feel that moving over that muscle?
Yeah.
Tightens up, huh? Right there. There it is. Good. And then move this internal again. This puts the piriformis muscle into an active type of a contraction, so you get better results on that. So I'm also going to get on his piriformis on this side. Push inward first. Maybe get down even a little bit lower right there. Does that one feel like it's more on it? Yeah. And then I'm going to pull it out. This probably hurts the most. I don't want to knock him over. I haven't lost a patient on the floor yet. I don't want to start with Indy. Okay. Oh boy, right there, huh? Okay. You feel that muscle moving and you feel my elbow rolling over it? Mm-hmm. Yep. I know you do. Okay, so now that we've done that, legs are exactly even. Indy, tell me if this hurts anywhere in your lower back or pelvis.
No.
Excellent. So I want you to take some deep breaths because I am going to use the turbinator on you today again. This is even more intense than my elbow. The white knuckle syndrome treatment here. As many of you have noticed, this is just a real tooled Black & Decker jigsaw that I had a patient make for me. You can see how deep it is and how fast it is. So it gets really down deep in there. And it's my human meat tenderizer. You feel like that too?
Yeah.
Feel like you're getting tenderized? There's some pretty tender spots in there, huh? But whenever it's done, it feels a lot better. When I get that done on me, and I'm going to get that done on me today, my chiropractor is going to come by here this afternoon and adjust me, which we'll try to video that for y'all too, because I know y'all like seeing me get adjusted too. Which I like getting adjusted. I've been needing one for a couple weeks. He's been out of town. I have a chiropractor buddy here in Houston that he comes over and I adjust him and he adjusts me, and I taught him how to do the spinal decompression on me. So he's really only one of 3 chiropractors in the U.S. that I'll let touch me and adjust me. And I know a lot of you said, you know, last time I was doing the video with him adjusting me, that I was telling him what to do. Well, yeah, I taught him to do exactly what I do because it doesn't hurt me. If I get laid up on my side and somebody tries to do a lateral lumbar roll on me, it hurts me worse because I have what's called asymmetrical facets. And all it does is stretch and sprain the ligaments in my lumbosacral spine and sacroiliac spine. So I don't even let people do it to me. I don't care who they are, where they're from. They're not going to put me on the table and do a lumbar roll on me. And I'm not saying it's a bad adjustment for everyone, but it can cause ligamentous instability. That's why you don't see me doing it very often. I'll do it occasionally on somebody that's got a lot of fibrotic scar tissue and adhesions down in their low back and sacroiliac joints from previous accidents or injuries or surgeries that they've had. But you don't see me doing it very often because it will over time create ligamentous instability, and then you feel like you always got to twist your pelvis all the time to crack your back. And that's the instability. You shouldn't have to feel like you got to crack your back all the time. And if you do, that means you're out of place and there's a problem. Okay, very good. That felt much better than my elbow in the turbinator, didn't it? Yep. Okay, so now I'm going to move up a little bit. I'm going to put your head down just a little bit here, Indy. Okay, now let's let all of your air out. Okay, and exhale. Better. That's it. There we go. That's it. I get a better grip using this towel in there. I know a lot of you will say, well, how come you don't do skin on skin adjusting? And I have done that, and it does work as long as you don't have lotion or anything on the skin. But if you got lotion on the skin, you can't really do that because your pisiform process and the part of your hand that you use to adjust, it'll slip. And I'm doing some oblique and lateral stretching here, which you feel that right there? Mm-hmm. You'll oftentimes get movement anywhere from the lower lumbar spine all the way up into the upper thoracic spine when you do this. It'd be like a heavy-duty clunk. And that's just the muscles pulling the vertebrae. Muscles move bones. Ligaments hold bone to bone. So we want to retrain people's muscles and ligaments to hold them in place as opposed to out of place where they've gotten used to over the years. And that's part of the spinal remodeling process. Davis's law, James Syriac, orthopedic surgeon's work back in the 50s, showed that ligaments and muscles do remodel along the lines of tension and stress that they're being put under over time or cumulatively. So that's why you see us doing these treatments repetitively over a period of time so that we can start remodeling the muscles and ligaments of the spine to hold that patient in place as opposed to this out of place position that they've gotten used to over their lifetimes. That's why getting adjusted young is an excellent idea, including even infants. I've been under chiropractic care since I was in the 6th grade, and it saved my life and changed my life. So that's when I decided I was going to become a chiropractor and not a medical doctor in the 8th grade, because it completely cured my asthma. Now, it didn't. I shouldn't say it, or chiropractic didn't, but when the chiropractor adjusted my vertebrae in my neck and upper back that freed the nerves up, that supplied my bronchial tubes, no more bronchial spasm, no more asthma, no more inhalers, no more shots. no more oxygen tents, no more epinephrine, and I was able to function as a normal 8th grader and get back into all my sports. I played football, basketball, baseball, everything. Martial arts was my biggest sport, and that made me a much better chiropractor when I went to Palmer College of Chiropractic in Davenport, Iowa. But we have a lot of different tools in our toolbox that we use on patients for different types of problems. So, okay, let's turn you on your back now. That's probably felt pretty deep today, didn't it?
Yeah.
Good. Okay. Deep breaths for me through your nose, out through your mouth. Tilt your head a little bit right. Perfect. Yes, sir. There we go. Okay. Are you on that towel enough? Here, let me get this. There you go. Okay. Now, I'm going to kind of slide you down here, Indy. There you go. And just put your arms out like that up to the ceiling. Now I'm adjusting his AC joints, which is the acromioclavicular joints in his shoulders, the costosternal joint right here where the clavicle and the sternum meet, and then the anterior costosternal joints, which are where the ribs meet the sternum. And his right rib cage was a little bit lower than his left when we started, but you can see that that's now evening out pretty good. In fact, that's really good. Much better than it was. Okay, now let's slide you back up that way, Indy, and just pull this towel up for you too. There you go. Okay. All right, now take a deep breath in for me. Sammy, you want to come over here? Yeah. So I'm grabbing the top portion of the stomach, or the fundus, and I'm pulling that down deep. I'm not sliding on his skin. I'm actually pulling his stomach down deep inside. Okay, so I'm going to have you step over here on this one now. Sammy, and go ahead and show me how. Remember, go in slow and easy, and then get deep in there and push and pull at the same time downward. So you're sliding on his skin. Don't slide on his skin. Get the organ. So did that feel anywhere close to being as deep as what I was doing?
Not as deep.
Okay. So what you got to do, Sammy, is you got to, here, put your hands down there. I'm going to help you. Deep breath in. Exhale. So you want to get on top of the organ. See how deep I am right now? And I'm not sliding on his skin. I'm actually pulling his stomach down. Did you feel the difference?
Yeah.
Okay, go ahead and try that again yourself now. Okay, don't slide on his skin, remember. You're going to get the organ and pull it down. It's really hard doing this not being a professional, but, you know, we have family members that come in with our patients, and we teach them how to do the best they can, pulling this down, and we stay away from the liver and the pancreas and the gallbladder. We're staying more over to the left side under the rib cage, and that's where you're feeling most of the obstruction and restriction anyway, right? Okay, let's sit you up and face towards Renee. Thank you, Simmy. Okay, now we're going to adjust his shoulders, glenohumeral joints, which is a lot better movement there today, actually. Good. Okay. Good, excellent. Okay, Indy, would you mind sharing with our YouTube subscribers? This is your third visit here. So how do you feel that you've done in the 3 visits that you've been here so far?
Well, I've slept well.
Okay.
I went to sleep straight away yesterday.
And that's been a problem for you?
Yeah, I've been getting really burning pains and stabbing pains, and I've not had that yesterday night, and I've slept all the way through.
And have you been eating more?
Oh, I've been eating. I had a big meal yesterday night, and I went to sleep within a couple of hours. Usually I would wait a big gap.
Right. And you didn't have any hiatal hernia
I didn't have
symptoms last night at all, did you?
No burning pains, nothing.
Great. And is your breathing becoming easier as we go along?
A lot better, yeah.
Okay, good. So if you got people, your fellow UK people across the pond watching this, would you tell them this has been worth your while to come over here and do this?
Oh, definitely.
Have you quit taking your medication for your...
Yeah, I'm not taking it all today.
And I didn't tell you to do that. You're doing that on your own, right?
Yeah.
Good. So we don't advise patients on taking medications, but often patients are able to get off their medications because they don't need them anymore. So this is your Houston chiropractor and Andy from Houston, Texas at Advanced Chiropractic Relief. We'll see you next time.